Hey, how you doing, Undeniable Me? You been busy? I hadn't seen you in a couple of days. Oh, really? Oh, wow. Yeah. I guess some notifications. Because I hadn't been getting some of the notifications too. So that's probably it. Well, you can always get the replays. Yeah. Hey, how you doing, Aquarius Mindset? How you doing? Good, good, good. I'm doing good. Y'all resting? Or resting up for work or at work, going to work. Let me turn my light on right quick. Hey, oh, stop it. Hey, Miss Burnett, how you doing? My dogs had a moment. They just wanted to bark for no reason. Wait. Um, trying to see how I want to do this. Mm-mm-mm. I think first, I think I want to. You better be quiet. I think I want to read the symptoms. Um, talk about the symptoms of ovarian cancer. Let's see, put this right here somewhere. I don't think there'll be any more people. I got 11. Okay, we'll talk about the symptoms of ovarian cancer. I know with my wife, uh, she started out, she had, she thought it was indigestion. Um, and then it got worse and got worse. And then she noticed that it was hard for her to button her pants. And then she really like paid attention that her stomach was swollen. And when she would touch on it or press it, it hurt. So it's painful. After that, she waited. She had to wait until her doctor was out of town on vacation, so she went to another doctor that was in her doctor's office, and this doctor supposedly checked her out, and he said that she had indigestion. So he prescribed her some Prolasac, something for indigestion. She took that for a couple of days and it did not change any of her symptoms. Uh, by the time she could get an appointment to go back in to see the doctor, her doctor had made it back from vacation. As soon as her doctor came in and say, what's going on? And she seen that her stomach was swollen. um, she got that look in her face, and she said, "I need to send you to get a sonogram." And so my wife was like, "Sonogram? You ain't even examined me." But that's when she sort of knew that there was something wrong. So she went took the sonogram, and when the test came back, um, they could see a mass, a large mass, um, and not then, but when she went to the doctor had scheduled her for an appointment at a gynecologist oncologist, and that was when she was told that she had ovarian cancer. Now I'm gonna read these symptoms because you may not have all of them. You could have some of them, and some women don't have all of them, and some do. So the first one is bloating. The second one is your tummy is swollen with pain. The third is backache. The fourth one is your irregular cycle. Fatigue is number 5. 6, your feeling of fullness when you eat. My wife could only eat a little bit, and she said she was full. Um, and then painful intercourse, constipation or diarrhea, indigestion, increased urination, and this last one, um, I didn't realize it until I read. Um, I think it was 2 stories in here. It was the tuberculosis. So those are uh, all of the symptoms that all of these ladies have put together, and basically it's a list of 11. And the 2 tests that you take for well, the 3 things that the doctors will send you when they think they know something, they'll send you for an ultrasound, CT scan, or a sonogram. Yes, and that's why it's so difficult to diagnose, because the symptoms are something that women go through. It's just normal, for your menstrual cycle. Some women have irregular, or it become irregular. Hey, hey, hey! And the bloating, when you're on your cycle, you get bloated. What else is another one? Being tired, fatigued. I don't know if I've ever been fatigued. I don't know, but um, and then constipation and diarrhea. That's something that people go through every day. So that's why it's difficult to diagnose. Um, and yeah, it's scary as hell to know these symptoms and know that you have had 2 or 3 of them, or you may be having 2 or 3 of them now, and then you scared. That's why it's so hard to diagnose. And then you have the test for to that they give, the blood test that they can give you for ovarian cancer is CA-125. The other test is for breast cancer. It's called BRAC2. BRAC2. They give that test to see if you have breast cancer. A woman that have breast cancer can also have uh, ovarian cancer. So they may find out that you have ovarian cancer, and next thing you know, you may have breast cancer also. I don't know how why it would be intertwined like that, but it is. I think they should test. No, this is they do first. Yeah, and they should, and that's why it was said in one of the stories that they should do that test every time you do your annual pap smear, because that way you will know, because the pap smear is, a lot of women don't know, um, with your pap smears they can't pick up if see if you have ovarian cancer with a pap smear. It's just not done like that. You have to have that. If you have those symptoms, um, and that CA-125 is going to be able to tell you. There have been some women that have not had the symptoms as the rest of the women, and the only way that they were able, my dog is doing crazy. The only way they have been able to found out in time that they have ovarian cancer. Onyx, be quiet. The only way they found out that they had ovarian cancer was because, like, one lady, she was going to have a weight loss surgery, and when they went in, that's when they found the ovarian cancer. Another one, she was going to have, what was that surgery she was going to have? It was some kind of operation that she was going to have, and they found it then. Um, then you go through chemo or and radiation. Like my wife, she went to chemo. She didn't do radiation, but some do both, or some do just chemo. Some of the chemo don't work on the aggressive type of cancer that you may have. My wife, her the ovarian cancer was attached to her liver, her spleen, not at the same time. First, it was just the liver, and then it attached itself to her spleen, and I think her gallbladder. And they removed the spleen, the gallbladder, and a part of her liver that it had attached to. So you can have to go through all that. She have had, and then she had a complete hysterectomy. Let me see what other surgery. Oh, she had the gallbladder and spleen removed. Then she had to have I think it's called debulking. I think that's right. Yeah, I think that. And and that's when her colon, or was it a colon? No, I think it was her small intestine. One of them had kinked, and she got, I mean, like really sick from that. They thought that she had a tear in it, and they had to do emergency surgery. They thought it was a tear. Once they got in, the doctor, after her surgery, the doctor had told us that it wasn't torn, it was kinked, and all he had to do was, unkink it. But I think because it was kinked, it was not getting the blood flow that it should have. So basically, I guess it like died, that part, and so they just cut it, and then they stitch it back. Um, and she didn't need a colostomy bag or anything like that, because they got it. The second thing, she did end up having to get a colostomy for her urine, because her kidneys had stopped working. She had it on both of them, but then eventually it was just one that needed, and she could still, go to the bathroom and pee um, normally, and then some of it would go into the bag. So she could do both. I'm trying to see if see what else I got here. And you also, um, if you got the aggressive cancer where the chemo is not doing it, is they can send you through some trials, and the medication, the chemo that is trials, it may help. It may kill some of the cancer. It may make it smaller. Uh, and if that's the case, that's a good. I mean, that's a good thing. Let's see what else. Yeah, y'all have any questions while I look? And usually they use I think the first time when you first diagnosed, they always use the same chemo. It's the, what is it? Taxol and, carboplatin. And for, usually on your second week, that's when you lose your hair. And that's have been what all the women um, have said. Even the doctor will tell you your second session, the second session of chemo, you will lose your hair. And the best thing to do for that is to cut it off before it start falling out itself, because it's definitely a it is definitely different if you cut it off yourself or you see your hair fall out in big clumps. Because my wife, she got up and she was combing her hair, and big clumps was coming out, and right then is when she said, "Come on, we're gonna go to the barber shop, and I'm gonna get them just cut my hair off." And we had said that anyway, but that's when she realized, when she actually found out that her hair was coming out. So went to the barber shop and just got it cut off. It it makes you feel a different way than if you cut your hair off or it's taken, if it's falling out. So it's just a different feeling. Let's see. I got all of those. I'm trying to make sure I got and the tuberculosis, which is the new symptom that I didn't know of until I was reading it in one of the latest story. And I think that the tuberculosis is, let me see, you have you have the symptoms of ovarian cancer. That's why I think that it is. For the lady that had contacted me, I still haven't talked to her yet. She was having stomach pain. Well, she couldn't eat but a little. Okay, and listen to it. Think about these symptoms that I'm telling you, that I told you, and what I'm telling you that she was telling me that was wrong with her. She said it has been gone on for a while, that um, she couldn't use the bathroom. Number two, she go weeks and weeks, but she had to start. She went to doctors. She done been to so many doctors, and it basically said, well, nothing is wrong, nothing wrong. Eat this, eat this, eat this, eat that. You know how they do tell you fibers in your diet so you can. None of that worked, and along with her not being able to, go to the bathroom, she had her stomach, every time she eats anything, and she can her stomach bloats every time, and it hurts her. I mean, she's like in dying pain. Now, can you imagine that for years and years you can't go to the bathroom normally like everybody else, and that you can't eat anything without going through that much pain? And sometimes you have to be taken to the hospital. Um, let's see what else. She had pain in the stomach, bloating, can't use the bathroom. Yes, yeah. Sounds awful. I mean, can't and you can't. I mean, you can't eat. She just try to eat a little cracker or something, and she's in pain. And that, I mean, it just doesn't sound good because it have all these symptoms of a person, of a woman that is ovarian cancer. Um, and then the other symptom that I did forget was having issues with your lungs. Onyx, be quiet. Having some issues with your lungs. I didn't. I forgot to write that one. Uh, that's, I don't know. It, it gets to me because I didn't know it. It caught me by surprise. Okay, I'm gonna read my. I don't think last night I did a reading, and then I think the day before, which is Wednesday, I did a reading. Um, I started the reading, and for some reason, I got emotional, um, and I broke down. And I think it was because I had, other than my wife, I hadn't read any of more stories of anybody passing away. And that story, the mother of the woman that was in the book, her mother died, and she had ovarian cancer too. But her mother died um, really quick as soon as they found out that she had, um, was able to find out that she had ovarian cancer. And because she had been hiding the pain that she was in and all the symptoms that she had been having, she hid it because she don't like to go to the doctor. And she just happened to be at her daughter's house when she was hurting real bad, and they took her to the doctor and found out she had ovarian cancer. And when she had to get emergency surgery, but when they opened her up, it was just all cancer was all in her stomach, and they couldn't do anything but to sew her back up and basically tell the family. I think she's supposed to had 3 months to live. I don't think she didn't make 3 months. I don't think. Yeah, she didn't make 3 months. So it was that story of the mother passing away that quick that it somehow got to me. Let me see. I lost my page. No questions. No questions. Yeah, but I mean, all I can say to any women that are listening, please, 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 if you have any of these symptoms, and you know your body, you know your body. If you're having stomach pains that are different than you've had before, if you're bloated but it's not going down, you can't get your pants, you know, you have to go and get checked out. And this, what they say painful intercourse, I guess you'll know me. Let's see. Your cycle is irregular, and you normally have not had any issues with your cycle for 10 years, and all of a sudden you haven't. Then you know your body. You have to do something because it's the difference between life and death. If you go to the doctor and they tell you it's nothing or that you're okay, you know, don't settle for that. It's the test. Look, I need you because this is my life. Okay. Well, some of them don't want to give you a test. I don't know if it's because they feel like, how do you know what test to give you, or if they just, I don't. It could be anything else because they know um, ovarian cancer is misdiagnosed most of the time. Um, and then that's your between life and death for you. So yeah, that's crazy. Yeah, it does. Hey, B Town. Yeah, it most definitely does. Okay, let's start with this one. Continuing the journey. A phase of my life. What? What are y'all? Hey, get over here and sit down. I don't know what y'all keep hearing. Go sit down. Come on, get in there. Justin, go sit down. Okay, my dog's tripping. A new phase of my life began June 15, 2008, when after being treated for a urinary tract. Yes, it's a $ decot for life. It's a simple one. Let me see, and I can't write it in. Let me know. Did you get it? Yeah, that's fine. That's definitely fine. Yeah, that's why I had taken my super chat. I disabled it, but I enabled it only because you have to get you have to get enough money. You have to $100 is the threshold. If you don't have $100 in the threshold, you don't get any money until you make it to $100. So at that time that I put it back, I think I had like $57 in the threshold. That was the only reason that I put it back. I'm going to disable it because I don't see giving them 30% of a donation that somebody is donating to me. So yeah, I think I've reached my $100. So I'm gonna disable that. I just can't see giving them or not giving them taking 30%. But thank you, I appreciate it. Let's see. Okay. Okay. So uh, after being treated for a urinary tract infection, that was one of a series of three since April 2008. I decided it was time to change course and get another opinion. I was 75 years of age at that time and could not remember having had more than two urinary tract problems in my life. During these episodes, I had asked why my stomach was so bloated and why the purple pill wasn't working too well on indigestion. Same thing my wife. That's what they gave her. I got a goes with the territory answer. Okay. I was still working full time as a court administrator and thought I had been doing all the right things. Getting a physical every year, as well as a bone density test, blood work, chest x-ray, mammogram, dental cleanings, etc. All tests had always come back good. So after 4 days of fever, going way up and then breaking, I decided I needed to see if I could get some answers other than what I had been getting. One of my daughters went with me to the emergency room at Baylor Medical Center at Garland. When I first registered, they took my blood pressure good, temperature 99, and I waited to be seen. Since I didn't look ill at all, we waited 4.5 hours to be seen since quite a few people there was not only looked sick, but came in with their own pale or in a couple of instances literally fell on the floor. After witnessing all of this for several hours, I said, Seth, you are having a major pity party. I was about to tell my daughter to just forget it and let's go home. Then they asked me back, and the ER doctor on duty said he was going to order a chest x-ray. I told him about the bloating and indigestion and asked him if they could x-ray my stomach also. He changed his order to 3 x-rays instead of 1. When I next saw him, he said my white count was high, but his main concern was that he was seeing a blockage and wanted to do a CAT scan. Now that got my attention. After the CAT scan, the doctor returned and asked if there was any history of ovarian cancer in my family, which there was my mother. The doctor then told me that my diagnosis was ovarian cancer and that the gynecologist would see me the next day. By this time, it was 2 a.m. At this point, I was not only in what felt like an out-of-body experience, but my daughter was in total shock. She and my other daughter were young when my mother was operated on and never came home from the hospital. So here I was. Was my fate going to be the same? I think seeing the emotional impact of more information than you wanted to hear on my daughter's face made me somewhat numb to my own situation. The next day, the Dr. Trussell, father and son, told me I had stage 4 ovarian cancer and would need to have some major surgery very soon. They referred me to Dr. Alan Stringer, who saw me the next Monday and scheduled surgery for the next Friday. I can never thank the Dr. Trussells enough for sending me to Dr. Stringer. I can okay. I believe God does work in directing us to paths and people who enrich our lives. After talking with Dr. Stringer, I knew without a doubt that I had no hesitation in putting my destiny in his hands. His genuine concern and that of his nurse, Beth, and his entire staff made a frightening and overwhelming experience into a positive one. All have been amazing and very supportive. My CA 125 level at the time of surgery was 3,200. Wow. The surgery was successful. I had one tumor the size of a small loaf of bread, another the size of a grapefruit, and another the size of an orange. So I lost about 25 pounds instantly. I had 6 rounds of chemo, and after the first round, my CA 125 went to 232. After that, my levels were in the 10 to 12 range. My CT scan after finishing chemo was good. I feel so blessed. My chemo experience, which at times felt like being run over by a truck, really went really well. I was told at my last visit that I was in the good 50% who had made it this far. Now have I now have fuzz on my head. My eyebrows are back, and the other subtle effects of chemotherapy are slowly receding. During the surgery, it was necessary for me to have an what is that? Ostomy. Okay, but that has been has now been reversed. That's a story of its own. After 20 years in the court system, I just recently retired. After recovering from the surgery for the ostomy reversal, I hope to begin painting again, playing bridge, and taking an active role in the ovarian support group. I also hope to take part in a clinical trial soon. I was only able to attend 2 meetings of the support group during the past 7 months because of work. But I was so impressed with the wonderful women I met, and I look forward to getting to know all of them better. Beth Robinson is so good to keep us all informed and aware that we are a part of a special group of women and that we need one another in a special way. I have had so much support from my family, friends, all of the wonderful medical technicians at Baylor, the nursing staff at Baylor who were always there for me after my surgery, and most of all from Dr. Stringer and his staff, who never made me feel like a sickie. Although I know this journey has just begun, I hope to be around for a long time so that I can in some way give back and contribute my time and energy for the gift that I have been blessed with, time. The first day after my surgery, my granddaughter brought me a copy of Torch. The book, this is the book here. Uh, Tales of Remarkable Courage and Hope by the women in the Ovarian Cancer Group. I have gone back to this book time after time, and I have so much admiration for those who contribute to it. I know that some of them are no longer with us, but I feel honored to be a member of this outstanding group. God bless you and never give up the journey. I look forward to continue the journey with you. And this was by Margaret Dennison. Oh, oh, okay. Yeah, yeah, you got. Yeah, it's a $ DCOP number 4 LIFE. So I think you got it. Yeah. See what did I miss? Did I miss? Make sure you see it to the right person. There's someone with the exact. Oh, really? Oh, okay. Her picture is on the right. Yeah, my picture will show up. Mm-hmm. Okay, journaling the journey. A journey is a trip, a passage, a stage, an experience, or a course. A journal is a record of your journey. My journal began June 20th, 1980, so my children and grandchildren have a record of my family history. Hard times, high times, and heroes. I hope one day they will treasure my notes. Maybe they will even consider them as a guide for their own journey. One thing they will know for sure, I have never doubted that God has his hand on me. In reviewing my notes, I know that I will not encounter anything or anyone that is bigger than God. That's been a real stake in the ground for me on this ovarian cancer journey. Try journaling. You won't be sorry. In this second book of ours, Torch, Still Burning Brightly, you have read stories of hope. Following is a section entitled Traveler's Notes, with stories written by seasoned travelers. You will read essays from a 19-year-old survivor, as well as an 11-year survivor and an 8-year survivor. A widow of 4 months shared his thoughts with you. The next session is entitled Traveler's Guide. There is a powerful poem written by one of our chaplains. His office is right outside our meeting room, so he gives you a glimpse of our group. There is some material gathered from an interview with the head of our palliative care team, Dr. Robert Fine. We also included a list of symptoms for you, and there are many good resources. The book ends as many of our meetings do. Louise Kelly closes us out and leaves us laughing. Laughter really is good medicine. Research proves the benefits of laughter. It's been shown to be beneficial to our immune system. One pastor is a true believer in holy humor. He leaves his congregation laughing on Sunday mornings. Our group is fortunate. We have Louise, who believes in laughter. You will read a sample of her work, and this is by the publisher of this book, and that's Becky Teeter. Coping while hoping. If you had told me 8 years ago that I would lose my job, my hair, my good health, and be in the biggest battle of my life, I would have said no way. However, life took a detour from my plan when a beast called cancer came calling. On October 31st, 2000, the day after my 51st birthday, I was told I had ovarian cancer, advanced ovarian cancer. It turned out to be stage 3C. I went into a state of shock. I listened to what the doctor told me. I did what she said was necessary to give me any chance of surviving, that being surgery and 6 rounds of chemotherapy. I read about statistics which were grim. Then, only a few weeks out of surgery, I joined a support group. I began to get stronger and began to reassess my life. As most people who have been diagnosed with cancer will tell you, their priorities change. I decided to totally rearrange my life pie chart. Gone was the slice that was work. Larger were the slices of family, especially my grandchildren, and a new slice was added, one to help others and pay it forward. I learned to say no to people with great ease. I sought out things and people who brought joy to my life. I learned not to sweat the small things as much. Some of these things came easily for me, and some did not. For a gal who runs from change as if a swarm of bees was chasing her, I did okay. I realize some women don't want to join a support group, but for me, it was literally a lifesaver. Some women want to continue working because they love their work so much. I say just do whatever makes you happy. Having a good sense of humor about the hiccups in life has helped me too. When I get ready, when I when I get really stressed, I go get a massage. I've had to back away from negative friends, but have embraced new ones. One of my worst fears has been losing my hair. I am facing having to take a chemo, having to take a chemo that will make me bald again. This time when I go wig shopping, I will take a trusted friend and get her to take a picture of me in each wig I try on. Then I will go home and take my time looking at the pictures to see which one I think looks best. Why didn't I think of that the first time? We live and learn. I think it is important when one is first diagnosed to have a strong motivation for living. For me, it was my precious grandchildren. I wanted to live long enough for them to be able to remember me. I once heard a wise doctor advise his patients to be hopeful and to set more short term goals than long term ones. As I began to do that and accomplish the goal, it felt so good. Then I would go on to the next goal. My granddaughter is now 10, and my grandson is 8. And yes, indeed, I think they will remember me. Webster's dictionary says cope means to fight or contend with successfully. I can't say that I have been successful 100% of the time in my quest to cope, but after 8 years and 90 chemo treatments, I am still here and still fighting. When I do have a setback and get down, I can hear the theme song to the movie Rocky playing in my head. Then I then I dust myself off and get back up. Before you know it, I have set and met a short-term honeydew for myself. And I say, life is good. And that was by K. Nodal, or something like that. Let's see, any questions? Oh, okay, that is an old one. There's one's called Striped Pajamas. There, there is good news and bad news in this story. The good news is that some of us are fortunate enough to survive having ovarian cancer. I am part of the good news. In December 2008, I made it into the 11-year survivors group. I have arrived at this point after having surgery and 8 rounds of chemotherapy using the gold standard Toxel and carboplatin, alternated with a drug called topican, which was not approved by the Food and Drug Administration at the time. If my memory is correct, I was called top, topican 6. I think it's supposed to be. It was called, meaning I meaning I was the sixth patient in Dallas to have this drug, which was combined with carboplatin and almost killed several before me but it knocked their bone marrow for a real loop. Since I was young, 54, hey Mo, since I was young, 54, and had never been ill before, my bone marrow was awesome. The chemotherapy treatments would knock my blood counts down so low that my doctor kept preparing me for needing blood transfusions. However, the day before my next treatment, the counts would bounce right back up. I was really lucky. After my chemotherapy was completed, I begged for something else to keep me well. My oncologist saw a willing guinea pig, and I signed up for a double blind study of Ovarian and immunotherapeutic monoclonal antibody. Okay. To this day, I don't know if I got the study drug or not, but I surely told myself I did. Amazing as it may, I remained in remission. Most of my brave friends in the support group had recurrences after recurrences. They were on many different types of drugs, all fighting to stay in remission. On the days of my checkup, I would be almost ill with anxiety. Each time I got the news, NED, which is no evidence of drug, peace and serenity were mine until a week before the next checkup. The bad news was that I began to feel terrible going to my wonderful support group of women who were still fighting to stay alive, growing hair and having it fall out again, dragging into a group with barely enough energy to go sit in a chair. Sometimes we cried, sometimes we grieved at the loss of one of our fellow travelers, but mostly we laughed and loved each other like there was no tomorrow. We all knew we might not have a tomorrow. My survivor's guilt kept getting worse, and I would go to group less and less often. When Monday rolled around, I would remind myself how angry I was in those early months that longtime survivors rarely came to meetings. Darn it, I wanted them to come. I wanted them to show me, tell me how to survive this cancer, but they did not come. Gradually, I began to understand why. It was so painful to watch the others fight so hard when my fight seemed to have been so easy and I was still well. I would leave meetings and cry all the way home, wondering why I survived and they were sick and or dying. Somewhere in my mind, I convinced myself that they resented my being there, and I gave myself an excuse not to go to group except once or twice a year. Each time after a long absence, I found the faces in the group to be different. Some were the same, but many were not there anymore. The worst times were when I went and the group was very small. Then suddenly I would go back and the room was hey, and the room was full again. A whole new crop of ovarian cancer patients. Finally, I decided I had to go on with life, and maybe if I didn't go to group, I would stop being afraid of having a recurrence. Staying away did not help. To this day, I still fear a recurrence. 11, 11 years, 2 months, and 28 days later, I still have that fear. The survivor's guilt. Justin, be quiet. Let's see what it says. I know they hear those kids coming in here. I still have the fear. The survivor's guilt is still there, but in the back of my mind, I remember how I felt when the long-term survivors did not come when I was so very ill. Hey, go sit down. They hear them kids. Hey, okay, just put it down. Put it down. Okay. All right. Hey, Gio, stop it. I'm recording, so y'all stop with the dogs. Onyx, Lord. That's what you get. Okay, let me see what. I lost my pet. Let me find. Okay. Each time after a long absence, I found the faces in the group to be different. Some were the same, but many were not there anymore. The worst times were when I went and the group was very small. Then suddenly I would go back and the room was full again. A whole new crop of ovarian cancer patients. Finally, I decided I had to go on with life, and maybe if I didn't go to group, I would stop being afraid of having recurrence. Uh, staying away, staying away did not help. To this day, I still fear a recurrence. 11 years, 2 months, and 28 days later, I still have that fear. The survivor's guilt is still there, but in the back of my mind, I remember how I felt when the long-term survivors did not come when I was so very ill. Several months ago, my minister, George Mason, preached a sermon about the movie The Boy in the Striped Pajamas. I had not seen it because I knew it was sad, and I avoid sadness whenever possible. The movie is about a little boy, the son of a German officer at a concentration camp. He played behind their house outside the concentration camp, and one day he came to a fence. On the other side of the fence was another little boy in striped pajamas. They became wonderful friends, and the boy in the striped pajamas shared with his friend that he was going to sneak into another part of the camp to look for his father. Being a good friend, the German officer's son said he wanted to help. They hatched a plan. The boy on the outside of the fence brought a shovel with him one day, and the boy on the inside brought a pair of striped pajamas. The boy on the outside dug under the fence with his shovel and put on the striped pajamas to look like his friend. Then they set off to find the missing father in another part of the concentration camp. The ending is too sad to write here. You go see the movie and you will understand. Oh, you seen the movie? You see? Oh wow. Oh my goodness. And what was it called? What was it called? The Boy in the Striped Pajamas. I'm going to look for that. Okay. On an ordinary Sunday, George Mason preached his sermon about the boy in the pajamas, in the boy in the striped pajamas, and then gave us all a challenge. Go find the shovel, dig under the fence, put on striped pajamas, and help someone on the other side of the fence. Oh, I'm gonna have to look for it. Wow, it hit me right between the eyes. I didn't even have to think about how I might use my shovel. I knew where the fence was, and I figured I could imagine I had on striped pajamas. As the next Monday approached, I knew it was my time to get over my selfish survivor's guilt. Grabbed the shovel and started digging. As I pulled into the Baylor Salmons Cancer Center parking lot, all the old feelings came pouring in. I had nothing to feel. I had nothing to feel anxious about or fear, but just coming to this place always triggered these feelings. I parked the car and kept digging. As I entered the building, the smells just about made me turn around. They too were associated with fears of cancer, needles, chemotherapy, nausea, hair loss, fatigue. I kept digging and I made my way into the room where my wonderful support group meets. I put on my striped pajamas and went inside. It was time for me to help those on the other side of the fence. I have been given the gift of survival from this horrible disease. From this horrible disease was a wonderful blessing. Hey, hey, hey. See, I think my work on the other side of the fence is to wear those striped pajamas, even if they are rough and make me itchy and uncomfortable, and to give these wonderful, fighting, brave women hope so they can face another day and know they too might be a survivor. As it turned out, the gift that day was not my giving, but receiving the love and understanding of my friends. One day I will walk in there in some real striped pajamas. It was by Peggy. Hello, Silky Black. I ain't gonna bore y'all too long. I'll read this other one. This read the last one. The wedding ring. My husband Joe and I were headed home from attending a family wedding when I heard the words, "Why did you give your wedding ring away?" Now I was in trouble, up to my eyeballs. I was so sick that whole weekend, and as my body got sicker, my mind just got a little, or maybe a lot, nuttier. I had survived ovarian cancer for 18 years, had been on almost every chemotherapy treatment, and had been in and out of remission many times. Now I wondered if I might be headed for glory more quickly than I thought. I always knew that when I died, our daughter Kathy would inherit my wedding ring. So while sitting on the bed in the motel room, I took the ring from my finger and gave it to her. In spite of all her protests, I insisted she keep it. I intended to tell Joe what and why it happened, but Kat beat me to it. The little wart tattled to her daddy. It wasn't long before I landed in the hospital for a 2 week stay. I don't think anyone thought I would come out alive, and if I did, I wouldn't last for long. By the grace of God, I made it home. Once there, I realized that I had absolutely no strength. Eating was a huge problem. I couldn't make myself swallow anything. Nothing would go down. I knew that food was my energy source. I was going to have to get it into my system in order to live. Sleep had eluded me, and I had many hours to ponder things and talk to God. I remembered the Bible story of the woman who had a serious bleeding problem. She saw Jesus in a large throng of people. She longed for him to get close enough to her so she could reach out and touch his garment. She knew just touching it would heal her. In faith, she reached out and no more bleeding. She was healed. As I lay in bed, I pictured myself in that same situation. I was desperate for God's strength. In my mind, I saw Jesus pass by. I reached out and touched the hem of his garment. I thanked him for being there for me too. About about 3 a.m., still awake, I had this strange feeling that I was hungry. I walked downstairs, opened the fridge, and saw a leftover pork chop from Joe's supper. I grabbed it and went back upstairs. I gnawed on that silly cold pork chop until it was all gone. It was delicious. It started me back to eating, and because I prayed for God's strength, He graciously gave it to me. Once I got to feeling good, I knew I wanted my ring back. My finger didn't feel right without it. I called Kat and apologized for being an Indian giver. She was so sweet and agreed that I needed my ring. Kat lives in Galveston. She was still trying to clean up the mess that Hurricane Ike had left. I was anxious to get my ring back and ignored the bad condition of the postal service. Mail it right away, I said. That was another nutty decision. Weeks went by and no ring. Kathy felt so bad, and so did I, but we weren't going to give up hope. One day I thought about the woman in the Bible who had lost her coin. She searched diligently in her home for it. I could just see her moving all her furniture, feeling under the cushions, pulling up the rugs, and praying without ceasing that she would find her coin. I bowed my head and talked to Jesus about the story. Lord, you help that sweet lady find her coin. I know you know where my ring is. It could be in the bottom of a sack, on the floor, in a box, or even on someone's finger. But you know exactly where it is. Okay. You know it. Okay. Would you please help find it so I can have it back? Thank you. A few days later, Kat called laughing and excited. Mother, I have your ring. She had put the wrong zip code on the address, and they had sent it back. Talk about a God thing. Do not put it back in the mail. I told her we would get it from her when we gathered for Thanksgiving. We met at the home of our son Spencer the day before Thanksgiving and spent the night. I thought it was odd that Kathy never approached me with the ring. The next day I asked her if she'd bring the ring, and she said yes. She said she'll give it to me later in the day. Now I was really puzzled. After we ate our big Thanksgiving meal, Kathy told me to go upstairs to a certain bedroom. I entered the room, and there on the bed was a white veil with a rhinestone pin. Kat and her siblings, their wives, and our grandchildren had decided that we would have a wedding. I stood at the top of the winding stairs in my veil, looking down. I saw my groom sporting a what is that? Boutonniere, something. Besides him stood our sons, Scott and Spencer, as the best men. Our daughter-in-law, Melinda and Debbie, were the matrons of honor. Kristen and Phelan, our granddaughters, were the bridesmaids. Our youngest granddaughter, Haley, was the preacher. She read from the love chapter, 1 Corinthians 13. Our grandsons Spencer and Reed started playing the wedding march on their clarinets, and was the Kat was on her ukulele. Okay. When I stood beside Joe, he said, "After 57 years, 3 children, and 7 grandchildren, will you marry me?" I said yes, and he placed the beloved ring on my finger. It was home at last. The whole thing was so cute, funny, and sweet. None of us will ever forget it. Once again, we had a breathtaking blessing. And that was about Dodie Stovall. Yes. That was a nice one. Okay. All right. I hope I didn't make y'all put y'all to sleep. Hello, Cheryl Williams. Uh, any y'all have any questions? Yeah, that it was. Yeah. So that one, the boy in the striped pajamas. I'm gonna have to look on Netflix for that. So yeah, okay. I think I covered most of what I wanted to cover. Yeah. So I just wanted to go back through those symptoms that I had. All those symptoms, because I think let me see. Yeah, I had the one with the lungs. I forgot to add that one. That's one of the symptoms too. If you have lung problems, write that down quick. Yeah. Okay. So okay, that was it. No questions, anything. I won't hold y'all. I just wanted to go through those symptoms again and put all of them together, uh, so y'all would know the name of the test, um, the tests they would give you: the sonogram, CT scan, and CT scan, and the ultrasound that usually you have to take once they think that they know what you have, if you have a mass or something. Other than that, I think that's it. All right. Hmm. Yeah, I didn't want to bore y'all to death with my stories. Hmm. Hey, go over and check out Miss B Town Hester channel. She started doing her lives. All right, undeniable me. Thank you very much. I appreciate the cash out. Yeah, go check out B Town. I think for the last couple of days, she's been doing HIV. Oh, thank you. I appreciate it, of course. Yeah, she's been doing I think HIV and AIDS videos, and go over there and subscribe and check her out. And I ain't gonna hold y'all. I appreciate y'all for coming and listening. And y'all have a good weekend. And I may see y'all later on tonight. I came on early today just because I wanted to try to catch more people um, so they be able to get to hear. And all right, well, I will see y'all.